You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. We're back at Stellar Success Podcast. I'm Dr. Tudor Francu, and I have a great guest today, Dr. Michael Miller from Indianapolis with an interesting practice. Dr. Miller, how are you?
Wonderful, wonderful. Looking forward to my Indianapolis Colts opening game this Sunday against Houston. So I'm elated. I'm excited.
Good.
As long as we don't break our quarterback, we should be fine.
That's awesome. Dr. Miller, you have a great motto. We heal what others treat. What does it mean for you?
Well, it's interesting. I jokingly tell patients, for example, hopefully we'll get to talk about the work we're doing in substance abuse, is in our practice, we do something very, very unusual that I find is not done. We make a diagnosis. And I realize that as a fellow, healthcare professional, you laugh and say, what does that mean? I'm an osteopath. So part of my training is that holistic functional kind of medicine thing. And the goal is to meet our patients on their level, find out what they need, and then identify as close as we can to the real diagnosis, what it is they need, what it is they're suffering from. And then we direct that at quality of life. We heal what others treat. We see so many people out there doing things, the opioid crisis, where pain meds were just being doled out like M&Ms. Our goal is to try and get to the root of the problem. What's the real problem? What can we do to mitigate that? And dare I say, we've been very successful.
Okay, well, I want to continue on this questions then, if you're successful like that. Tell us a little bit about your journey. How did you start? How did you go through this? And where are you now?
Well, it's funny. I'm a board certified general surgeon. And like most general surgeons have moved hither and yon, to and fro. And basically, I've been smart enough to let my practice take me where it wanted to take me. It was not a matter of saying, this is all I'm going to do in this box. And so, for example, after being in general surgery for a fairly long time, went into wound care. Well, when you're in wound care, you see a lot of patients in their homes. And so we made a lot of house calls, and arguably still do, though telemedicine has helped quite a bit with that. From house calls, we realized that patients are not getting the care they need at home. We talk later about the new Medicare program, remote patient monitoring, chronic care management. Care delivery is best done in the home whenever possible for a lot of reasons. And so after making all these house calls, I realized that patients need more care. So from there, we did a palliative care program, and then patients were having horrible pain problems they couldn't get out for. So the pain management program was developed, and I brought on colleagues for that. And then, of course, if you're going to do pain management, invariably you see some pretty horrific things going on. We just had a lady today, 120 Percocet per month for osteoarthritis. So realizing that things were a bit skewed, moved into the substance abuse program, and then realizing that I am only one man, have brought on about 24 other colleagues, and now we do psychiatry, in-home mental and behavioral health, house call palliative care, pain management, substance abuse. The list goes on. We just added a new primary care board certified doc. So now we're doing primary care. She also does functional medicine and aesthetics. So any attempt by my wife and I to use the R word, retirement, seems to be moving farther and farther off on the horizon.
So it's interesting as a concept, right? For me and for many medical professionals like me, what you created is an entity, right? The Miller Care Group that is outside of the hospitals. It's a private enterprise, and it's very successful. What is your definition of success in this realm that you are in right now?
It's funny, and I'm going to talk about financial is awkward because, the concept of financial and medicine seem to both, embrace and divorce at the same time. So we don't worry about making a living. Our goal is to try and do it better and faster, and hence the motto you mentioned: we heal what the others treat. We get in there and see the care that's being performed, and in unfortunately far too many cases, what we see is not good. I don't think it's done poorly maliciously. I think it's either ignorance. I think it's taking their eye off the ball. And so if I tried to create my non-hospital affiliated entity starting now, I'd be starving. This is a labor of love over 30 years. And we get referrals as my office manager. We get 36 new referrals every week from sources that, and more often than not, we have no idea who they are. They're from the other hospital systems, outside providers. Someone has said to someone, hey, these people seem to know what they're doing. And so in terms of success, it's being able to deliver great care fairly uniformly.
Awesome. That's a great concept. I wish many people would do this in present day medicine, you know.
Same. And the patients have your feelings too.
Yeah, exactly. So being successful in this field means that you have to fail probably a lot of times. Uh, can you tell us some examples of things that didn't necessarily pan out for you and you learn from them and you move forward?
Being a wound care specialist of 30 plus years, so I had a penchant for lymphedema, for example, and hired a physician assistant who was extraordinarily skilled, sent him off for training, and we started a house call based lymphedema diagnostic and treatment. Extraordinary. I'm super proud of it even now, though it's been dead many years. The problem was that lymphedema at that time was only compensated by home healthcare agencies. So, of which I don't own, I'm not allowed actually because of Stark. So what we had to do was subcontract through home healthcare agencies. It worked fabulously. You know, it wasn't very profitable for the home healthcare agencies, but secondary, you know, they'd have their nurses in there. When we were done with the lymphedema, there was physical therapy. So the model worked great. Unfortunately, when COVID hit, the program dissolved. It basically dissolved. And that was disappointing. More recently, I had an offer to get a laser, to do laser tattoo removal and things of that aesthetic nature. And despite pretty extensive advertising, it never really gained momentum. And so fortunately, I have an aesthetic colleague who likes to do that stuff and is leasing my laser, you know, borrowing it, whatever. So, you know, you don't learn without making mistakes. That's the bottom line. The key is to make sure that the mistakes don't cause limb loss, death, but you know what? Anyone who would tell you that they've been a financial success and everything they've done has been a liar. My wife would tell you we've made more bad decisions as opposed to mistakes, you know, not in a vacuum, with as much information as we can. And then it didn't pan out. And you learn and you get a little bit smarter and you try not to step in the same hole the same time every time.
And you keep going.
You keep going. Yes, we do. Success begats success.
Exactly. Winners never quit. Also, you know, you seem to be a very entrepreneurial person, and this is something that for many medical professionals it's a little out of the box, I would say. We're not taught to be business professionals or entrepreneurs. How did you develop this skill? And, you know, what do you like to learn to be like this?
Well, it's interesting. I would harken back to the last statement we just made is, you know, how do you get better? You make mistakes and you learn from them. You know, many, many locations and considering other locations for different practice parameters. You know, the key is, can you dip your toe in the water and still feel the temperature of the water? Some people would tell you yes. Some people would tell you no. You know, I've gone with just the toe and I've gone with total body immersion in things. And, you know, the best you can do is plan. The best you can do is surround yourself with people that you trust and trust them. You know, the micromanagement concept of which we've all been guilty of, you find may work, but it doesn't prevent you from making mistakes. You know, either you trust good people and have them or you don't. And if you do, then you watch them and you work with them, but you let them do what they're best at.
Interesting. Do you like to take risks?
Yes, I call myself the little kid that's the first on the block to have the new toy. Any kind of scientific concepts, wound dressing, things of that nature. I do my homework, I seek the information from experts, and then if it sounds like it's good and I get my wife's permission of 39 years, then we go ahead and do it.
Awesome. Yeah, that's something that a lot of people, like yourself, in medical entrepreneurship they have to take risks.
Correct.
Otherwise, you can't progress. Um,
Interesting you say that. I tell people that if you are not moving forward, then you are falling behind. There's nothing even. I just had a conference call with, I'm a hospice medical director for Traditions Hospice here in Indianapolis and vicinity. Wonderful, fabulous care, great reputation. And one of the conversations I had was about palliative care in the home, of which in this area they don't currently have. And my point to them was, hospice is all well and good and it's fabulous and needed, but not every chronically ill candidate is a candidate for hospice. And if you're not getting to them at whatever level they are, then you run the risk of losing them to your competition. So can we develop palliative care? Can we expand our presence of this hospice in Indiana in the hope that, one, it benefits you, greater patient capture, greater area of coverage. And, if you don't mind taking me along for the ride, that would be great.
that's awesome. What are some skills or habits that you do every day to get you where you are?
I fortunately, as I mentioned before, I have a wife who thinks differently than I do, which is a great benefit. She is much less trusting than I am. I tell my patients, when I look you in the eye, when you tell me something, I'm going to believe you until you give me cause to not believe you. My wife, on the other hand, has a higher index of suspicion. I think that's the medically appropriate term. And so, that's kind of the way it's played. It's a matter of looking at this and hearkening to that. Who else can you trust but your family, but your wife? She's been with me on this journey since 1985, and so has a good insight into how I think, how I work. Do we agree on everything? Oh gosh, no. No. We've had some lovely discussions over many weeks, but the end result is that you get feedback from someone that has has a vested interest. She common law marriage, she owns half of everything, and so she's out looking for her investment, and also, a huge participant in the practice itself. The nuts and bolts are pretty much under my wife's auspices outside of the medical aspect.
I see. Very, very interesting. Um, as a whole practitioner right now, and also entrepreneur, how do you structure your daily life? How does a day look like in a life of Dr. Miller right now?
Well, I will tell you, the week of Dr. Miller, after 30 plus years, we have a wonderful 20-month-old granddaughter, and Wednesdays I take off, other than the occasional Zoom call or something. And my wife takes great pleasure in reminding me that it took a grandbaby to get me to take one day off per week. Otherwise, as I said, I'm a smart boy. I let my practice take me where I want to be. My own personal practice is a hodgepodge of advanced wound care, low narcotic pain management, minimally invasive. And of course, the love is substance abuse. That's really where my passion is. But based on 30 years and colleagues and inter-referrals from our group, whatever, the practice takes me where I want to go. On any given day, I do what's on my schedule. Lots of business development, as will come as no surprise. Lots happening in the substance abuse frontier. So my administrative time is increasing, my clinical time decreasing, incrementally. I think that's the key, is you don't fight the feeling. If your practice is taking you in a certain direction and you're doing well, you go with the flow, you go with the winds, you follow the stream,
Yes.
you let it go.
That's very uncommon, I would say, because
Yeah.
most of the people don't think this way. And probably one of the secrets, I would say, to your development at this point is the fact that you seem to think way outside the box. Am
Yes,
I
I've been
right?
accused of that.
I get this feeling about you
Well,
because, you know, some of the things that you accomplished are things that can only be done if you think outside the box.
yeah.
Um, how do you deal with this approach? Who taught you this?
Well, I was my family is comes from a long line of what the old term used to be haberdashers. The modern term is clothing salesman, and that was my family. Immigrants from Russia, both sides came up. My grandfather a tailor, and of course, most of my family was in the haberdashery business, clothing. So, and as a kid, I learned how to meet people, how to talk to people, how to make a friend from everybody. Not that every relationship I have is collegial and cordial, but the goal is to treat people the way you want to be treated. And that's been my mantra is I try and introduce myself. I try and find out about the other person. What are their interests? Even in my substance abuse practice, I tell them that, look, once you're under treatment and you're doing well, we do not talk about addiction. We talk about what you do, your family, your love life, your work life. Do you like the Colts? Not because you've got to, as I said, meet the people where they are. You're not going to drag them there. And that's how I think one of the keys to our success is we have a reputation for being very personable. And my team knows that one thing that will irritate the old man, which is their term of affection, is not responding to patients. Now patients will say, I called 5 times, no one answered. Yes, I'm going to investigate, and it rarely happens, but we treat people the way we want to be treated. I want to meet you. I want to be, if not your friend, at least a colleague and an acquaintance. The concept of networking. What can I do for you? What can you do for me and my circle of people?
Very interesting. It seems to be working very well.
Yeah, yeah.
That's awesome. Dr. Miller, in general, in medical profession, people are getting burned out.
Ah,
And by the time they retire, they don't want to practice anymore. And this is one of the things that everybody talks about. How do you create this passive income streams from different avenues? Do you have any ideas or preferences in terms of passive incomes?
absolutely. One of the things that I do in my spare time is, I do some medical legal consulting, both plaintiff and defense work, which keeps your brain sharp because, it's never black and white. There's always the
Mhm.
shades of gray, 360 degrees. That's a lot of fun. I do some consulting for industry, several of the companies that contact and ask you for your opinions on certain things. The fact that I have a multi-specialty group has benefits because it's, everybody working for the common cause. Part of it, I think, to kind of go to your question is to make it appealing and palatable for people to do what they want to do. My payment scheme, for example, is what I affectionately call eat what you kill. We provide 360-degree wraparound credentialing, billing, medical assisting, scribes. We provide all of that. Your job is to see patients. And, we make it very easy. Now, what are the bad news? Well, you're an independent contractor, so benefits are on you. Health insurance is on you. Your retirement is on you. But we don't have to deal with, providers that are interested. They control everything. What days do you want to work? How many days? How many patients? They control every aspect of their practice. Our job is to provide the infrastructure to fill in all the gaps. And even with that, we have some providers like my new primary care doc who could not join and sign her contract fast enough. And yet I've had docs have said, well, I need a guarantee of $350,000 a year. It's not going to happen. And I said, I'm not a hospital. You will eat what you kill because everyone wants you to think they're the greatest practitioner that there is. And in most cases they are. But if you're only seeing 8 patients a day, you are not going to be making 350,000 a year. If you're seeing 15 to 20 with all that support, now you're going to make a great living. But again, you want a day off, you take the day off. The corporation, myself, no power, no say. You run your own practice. And that can be very daunting when you're used to what I affectionately call the overlords. You will make 35 RVUs a day. And oh, by the way, we cut the value of the RVUs. And by the way, you're going to be providing oversight for all these medical assistants and not get paid for it. And don't forget about all these committees that you have to be on and all these. No, that doesn't exist in our organization.
Very interesting. Yeah, it's a great model and a great concept. And I think, hopefully more people would do it like you, and we come out of this like healthcare crisis in a way or another.
Horrible. It's horrible. The beaten dog concept, or the whip dog, no matter how much you beat the dog, it's going to stay with your master. On Sermo and several other physician websites. As they say in the old Schwarzenegger movie, the lamentation of the beaten, and the tearing of the cloth, and you see it and read it and hear it, and then I post and say, listen, here's my model. What do you think? Oh no, I can never do that.
Interesting.
Well, I don't know what to tell you.
Yeah.
You pick black or white. It doesn't offer both ways.
That's right. So, Dr. Miller, when somebody would come to you, as a mentor, and start off finishing medical school, getting to a residency, what kind of advice or pieces of advice you would have for someone like this to step in your footsteps?
Keys, I think, are to identify who is truly successful. Those are the people that you want to talk with, that you want to find out, what mistakes did you make? The question you asked was eloquent and appropriate. What do you now know that you should not do ever again in the future because it blew up in your face? Recognizing that someone down the block did the same thing and is now, doing hugely successful. So talking to successful people, finding out why they're successful, not being afraid to take a risk, especially young. I'm more or less toward the end of my career. Again, the R word, not yet in our vocabulary. So we don't have to take that many risks because we're incrementally adding. Somebody new, it's all risk. I started off as a board certified general surgeon. I now do wound care, pain management, and substance abuse medicine. That's a very far cry from general surgery, and I've also been smart enough to learn from my colleagues. I joke with my psychiatric colleagues, I can spell Lexapro, but I'm not really sure what it does.
That's a good point. What kind of new goals excite you right now? Because I'm sure you have something in mind.
I do.
The R word is not in your vocabulary. I can feel that.
Yeah. Well,
what's coming?
The new grandbaby, and my passion is I have a 1979 Fiat Spider, 46 years old. That's my toy that my wife insists is my next new car. And keeps reminding me, no, you don't need a car. You got that. The next project is it's a fabulous concept, and like everything else that's too good to be true, penetration has been extremely difficult, and yet on the same token, people are saying Medicare has created a program called remote patient monitoring, chronic care management. Too many hospitalizations, too many rehospitalizations, shortage of nurses, horrific. I jokingly tell people, I can get you all the unicorns that you want, but nurses are a mythological beast that do not exist. And they laugh and agree with me. And lastly is care's best in the home. So CMS has said, we're going to do this for free because it'll save us money. And the data is outrageously great on hospitalization reductions and care and cost reduction. And yet when we approach potential docs or groups and say, hey, this is a great thing for you. One, we're going to monitor your patient's blood pressure, sugars, weight, lung capacity, what have you. It's going to be fabulous. And it costs you nothing. And in fact, we're able to pay you for looking at the records. So there's something in it for you. And we're told, well, is there a HIPAA violation? No, there's no HIPAA. It's your patients you control. Is there a Stark violation? No, we're not paying you to play. You are working for this. And it's increasing slowly. And yet this is where my passion is right now, is this monitoring it's desperately needed. And it's a no-brainer of a program. That's the most common phrase used. And yet, my colleague who's doing the major marketing and business development is crying on the phone. I had another meeting. They're interested, but they're not ready to pull the plug or, flick the switch. It's like, okay. So for the benefit of healthcare, we're trying. And again, anybody listening to this podcast, this is a real phenomenon. It's phenomenal. It supports your patients. It supports you. And despite how fabulous it sounds, not happening, or happening very slow. I suspect it will. I think as CMS gets more data, they're going to say this is a great thing. Of course, sidebar conversation, telemedicine looks to be continuing, but in what form? Is it going to be the same form? Nobody knows.
Yeah,
Nobody knows. Too many unanswered questions.
Yeah, it's a very interesting concept, because as we all know, hospitals are doing great when they treat, critically ill patients. But in general, the fact that you are in a hospital is not good for anybody, for the patient, for the doctors, for the family. They get high number of infections from the hospitals, no matter what you do and no matter how you treat them. And they become, disabled or antibiotic resistant or whatever happens.
They come out more, the science, they come out more malnourished than when they go in, definitely. And of course you can argue and say, well, they're going in sicker, they need to recuperate. Yeah, hospital at home, the home care, if possible. And yet this morning, or was it this morning, I was reading an article on Google, and here's an article saying that the costs of care in the home have gone through the roof. Shortage of healthcare providers, so now you've got a much more competitive market. I think they quoted $14.03 is the median pay rate for a home healthcare worker, non-nurse, of course, medical assistant in the home. $14 an hour for what they do is outrageous. And here in Indiana, they just cut the fees, the payments for family members that care for family members. There's a lot of people that spend their days at home caring for a loved one. Indiana Medicaid just cut that rate. And so now there's a mad scramble. What do I do for caregivers? Well, I'm going to stay at home, but it was a lot easier when I was getting paid for it, because I can't work. I've got to care for my loved one. So it's, is Congress and the representatives listening to the docs somewhat? November will bring some very interesting changes, I portend.
Yes, I hope trickles down to healthcare at some point. But yeah. Dr. Miller, how can someone reach out to you if they need mentorship or advice or any kind of out of the box ideas?
Oh my gosh, I am thrilled and delighted. We are super prolific on social media. Michael Miller on LinkedIn, and look for this smiling face. Facebook, Michael Miller. We're on TikTok. Yes, I do not dance. There will be no dancing on TikTok, but my TikTok is the_doc_is_on_tick_talk. The doc is on TikTok. And the easiest way is the website, Miller Care Group. And I'm Doc, D-O-C, because as my wife says, I'm not really good at remembering things. So it was just easy to say Doc at millercaregroup.com. So, and that's awesome. We will answer, respond. Again, the methamphetamine thing that we spoke real briefly about. I've done many podcasts and people are starting to pay attention and say, well, this guy's having some success. And just today, I had a huge conversation with a provider in Wisconsin who said, I saw the podcast. You're the only one that seems to be having any success treating methamphetamine. How are you doing it? And I will tell you, it just comes out. I are delighted, thrilled to help anyone that asks for it. That's what we're supposed to be doing as physicians. We're supposed to be helping other people. And if I can, it's great. I jokingly tell people, if I help you, I get strokes. Now, I have no idea who's giving me the strokes. I have no idea what I'm going to do when I get enough of them, but I get strokes when I help somebody.
That's interesting. You heal what others treat, right? That's
Correct.
awesome. Thank you, Dr. Miller. I appreciate your time, and hopefully someone will really follow in your footsteps, because there is a lot of potential there.
There is, and the last statement I want to make is, the old phrase about standing on the shoulders of those that went before us to see farther. I'm 5'2" on a good day, and so I don't know how much farther they'll see on my shoulders. But conceptually, that's what's really important to me is making sure that anyone that I work with is better than I am.
Excellent. Nice way to finalize the podcast.
Thank you.
Thank you.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.